Hello, and welcome to your guide on cataract surgery. Today, we'll be discussing what you need to know about intraocular lens implants, or IOLs. Cataract surgery is a common procedure that allows you to replace your eye's aged and cloudy lens with a clear intraocular lens implant, or IOL. Why is this important? Well, you'll have a choice of the type of IOL that you'll be receiving in each eye. We can help you choose the right one based on your visual needs and candidacy. We divide vision into three zones: distance, intermediate, and near. Distance vision is what you use to drive or watch TV. Intermediate is for computer use or the dashboard of a car, and near is for reading a book or your phone. There are two classes of IOLs: single focus lenses and multifocus lenses. Single focus lenses can give you clear vision in one of the three zones while wearing glasses for the other ones. Multifocal lenses, on the other hand, can provide you with vision without glasses for all three zones. Even if you're not a candidate for a multifocal IOL, there's still an option called an extended depth of focus, or EDOF IOL, that can target two of the three zones, giving you glasses-free distance and intermediate vision. After evaluating your eyes and understanding your goals, we can help you choose the best IOL for you. Thank you for learning more about intraocular lens implants. We hope this information has been helpful in assisting you in your decision-making process. Don't worry, I'll go over it with you on your consultation. If you have any further questions, feel free to speak directly to us. Thank you.